Ruth here from runhappierpt.com, here with our next home exercise video. Today is all about quad strengthening and knee control. But first, this video is intended for information only. While I am a doctor of physical therapy, I'm not your physical therapist. Therefore, this video is not intended to diagnose, treat, prevent, or cure any injury or illness, and I highly recommend that you talk with your healthcare provider prior to starting any new exercise to make sure it's appropriate for you. All right, so when I was looking at the research for this video, really drove home the point that there's a lot of variety in the percentage of injuries that runners get, and there's a lot of variety in which body part is injured the most when it comes to runners, but there's pretty good consensus that the knee is the most common area of complaint as far as injuries and pain go for recreational runners, which I find fascinating because at first glance the knee joint seems pretty simple. You know, it's just like a basic hinge joint, just kind of flexes and bends, doesn't really have like a lot of 3D movement to it. It seems pretty simple. But when you start to dig a little bit further, come across a few facts that make it pretty clear why the knee maybe is more commonly injured in runners and what are some things we can do to help that, to improve our tolerance to running and our ability to run without injuring the knee joint. So the knee joint is actually two different joints. You have your tibiofemoral joint, which is the joint between your tibia or shin bone and your femur or thigh bone. This joint has movement mostly in one plane, so mostly the sagittal plane, which is flexion and extension. And a normal healthy knee has typically a few degrees of hyperextension, so extends beyond that zero position by a few degrees, and then also can flex or bend up to 150 degrees. For running, you really only use about 45 degrees of knee flexion and not even full extension. So joint mobility issues, not really a problem with the knee. It is a fairly unstable joint, however, in that it doesn't have good congruency or fit between the two bones that come together at the joint. And so it really relies a lot on the muscles that cross the knee joint for stability, which complicates matters a little bit because 2/3 of the muscles that cross your knee joint also cross either your ankle joint or your hip joint. So there's a lot of communication or combination of movement that movements at the hip and ankle will affect movements at the knee joint. Also complicating matters at the knee is the second knee joint, which is the patellofemoral joint, or the joint between the kneecap and the femur or thigh bone. This joint also a very, very unstable joint. If you're sitting with your knee straight and relaxed, you can slide that kneecap around like an ice cube on a hot skillet. It just has a lot of mobility. So it sits in a web of connective tissue, and there's a lot of different muscles that connect into that web of tissue, and then they help to guide the kneecap to move and track in the way that it should when we move the knee. They also keep it from sliding out or dislocating. The primary muscle involved in kneecap control is your quadriceps muscle, and so we're going to be focusing on quadriceps strengthening today. There's been a fair amount of research that has showed that quadriceps weakness is a major risk factor for knee injury, especially things like anterior knee pain or patellofemoral joint pain in runners. And so we're going to be focusing on that quad muscle strength and also control. So we talked about how 2/3 of the muscles that cross the knee joint also cross either the hip or the ankle, but also the way that the hip joint and the ankle joint move changes the alignment between the shin bone and the thigh bone, changes the alignment between the thigh bone and the kneecap, and therefore can change the way that these joints are moving on one another. and may contribute to injury as well. So I'm going to be going over 2 types of exercise today. Both of these I chose because they're easy to do at home. You don't need any special equipment. You can add weight to them, and I'll tell you how to do that to make them more challenging, but they don't require anything special. If you have access to a gym or weight machines, doing things like leg press, knee extension, hamstring curls, those kinds of machines or cable system exercises can also be super good for quad strengthening, so highly recommend those as well. But these 2, I'll give you lots of variations on them, so it'll keep you pretty busy. All right, so the first exercise is a basic single leg squat. So when I'm talking about knee control, there's not a whole lot of consensus on what biomechanical errors or movements around the knee contribute to knee injury, but a few movements have shown pretty consistent patterns with certain knee injuries. And so things like hip adduction, where your leg comes in towards the midline, hip internal rotation, where your leg rotates in towards the midline, tibial, so your shin, external rotation, so your shin bone rotating outwards, and possibly overpronation at the foot, but that one's kind of less certain in the research. So the hip adduction and hip internal rotation, those 2 things also contribute to a position known as, and the tibia external rotation, all contribute to a position known as knee valgus. So that's where your knees come in together and you make kind of a diamond shape with your legs. That position has been shown pretty consistently in research to contribute to tracking issues with the patella, anterior knee pain, knee injuries, those kinds of things. So that's what we want to avoid with these exercises. Those are the things we're going to be really focused on. So the single leg squat, basic form, is standing on one foot. Going to be sitting back in the hips with our normal good squat form. Trunk stays fairly upright, making sure that knee is staying pretty much behind or in line with your toes. Going down as low as you can and coming back up. So we want to avoid hinging really far forwards at the trunk or coming really far forwards into the knee. Also want to watch for, as we talked about, that position of knee valgus or rolling in of the hip so that the knees come together. So we want to make sure that we keep our knee in line with our second toe to keep everything lined up pretty well. Another thing to kind of pay attention to is your hip level. As you come down, if that knee is going to roll in, a lot of times we'll see the other hip drop down. So you may be able to monitor a little bit with your hands on your hips and just pay attention to if one hip is dropping down or if you're doing a good job of keeping everything pretty level as you go up and down. Now, one of the studies I looked at showed that a single leg squat to 65 degrees of knee bend loads your quadriceps muscle the same amount as the load it gets when you run. Now, it's obviously not as fast of a loading, but it's the same volume essentially. So you don't need any extra weight if you can go single leg squat down to 65 degrees. Now in running, as I said, you only flex your knee to about 45 degrees. So if you find that it's irritating in the knee to go so far down, you really only have to go about 45 degrees down. And then if you need more resistance to make it similar to the loads you experience when running, you can add some dumbbells, kettlebell, weighted backpack or vest, something along those lines. Variations of the single leg squat are numerous. So some of my favorites would be a 3-dimensional single leg squat. So for this one, you're going to have the other leg reach out towards the front, reach out towards the side, and then reach out towards the back. So this really challenges some of the balance and proprioception, foot muscle strength, ankle control, hip and trunk control as well. You can start with a slider, furniture slider, underneath the other foot to kind of help with balance and just get the feel down. But the goal is to eventually be able to hover that opposite leg. Other options would be things like step-ups. So something like a box, a step, a chair. I like to use the park bench when I walk my dogs in the morning. But again, mostly focusing on alignment and either practicing the come up and come all the way down, or starting from the top, trying to come down just to touch your toe and come back up. And again, paying attention to hip drop, knee position and alignment, control of that descent and ascent. Pistol squats are another good option. So these you can do as mini pistol squats where you're just standing with the other foot reaching out in front. You can have a chair or a box, something to aim for as you lower. Or if you're super strong, you can go all the way to the floor. But again, it's all about that control, all about that knee positioning, maintaining upright posture, hip drop, all those things. And if you want to increase the speed of loading to better mimic running, single leg jump squats are a perfectly good option. So basic low squat, jump. The other exercise for quad strengthening would be lunges. So a basic lunge, one foot in front, one foot in back, lowering down, and back up. Form for these is you want to keep your trunk fairly upright. You may feel tightness across the back hip. We're going to go over that in the next video, hip flexor mobility. So just note that if you find that it is really tight and your pelvis is either tilting out as you come down or rotating open as you come down, or that you're having to lean really far forwards, those are all signs that your hip flexibility is not what it should be. So either bring your back foot in closer so that that leg is more at a 90-degree vertical angle, or just don't go so far down. Again, want to pay attention to that front knee. Just make sure it's not coming in front of your toe and that it's staying in line with your second toe. Variations here include a similar 3 direction. So you would come into a forward, sideways, backwards series, or you could do them individually. When going out to the side, I like to keep the foot pointing straight ahead and really make sure you sit back in those hips. Can also do one of my favorites, the Bulgarian split squat, which is like a lunge, but with your back foot up on a chair. This one really tests the extensibility of your hip flexors, so that's something to note with this one. Toes can be tucked under or not, up to you. And then it's just coming down this way. So this puts a lot more loading on the front leg and works that back quad as it's in a more extended position. And again, with these you can add weights in whatever form you like. And then if you want to speed up the loading rate, things like Mary Catherine's. So where you're jumping in between switching lunges. All right, as far as like how much quad strength do you need, or how many reps should you be able to do, or how much weight should you be able to hold, there is no good study outlining how strong your quads need to be for proper running and good tolerance to running. So my advice is just continue to try to improve. Injury is most commonly related to training errors, so doing too much too soon, overloading your tissues. The tissues each of your body tissues has a certain amount of load that it's able to tolerate, and it's when we push past that point that we cause injury. So if you can up the amount of load that that tissue can tolerate, theoretically, you up the amount of running you can do before you hit that injury point. So, I mean, why not? Continue to get stronger. Push yourself to use more weight, do more reps. Just continue to build up so that you can kind of push that injury tolerance higher. Quad strengthening is not a really easy thing to incorporate into just daily activities, but knee control is super easy. So anytime you go up or down stairs, anytime you squat, anytime you get up or down from a chair, anytime you step up or down from a step stool or a ladder, watch your knee. Look to see if it's rolling in. Look to see when you're going up and down stairs if you're crossing your feet over. Feel to see if your knees are bumping or rubbing. Those are great ways to kind of monitor what control you have around your knee joints with just daily activities, and then practice good alignment with those activities, and that can help carry over some to running. So unfortunately, while quad strengthening is really good for your knees and may help prevent knee injury, it doesn't usually have good carryover to your running form. So when you're running, a few things to look out for in practice would be if you do find that you're running a crossover pattern, work on widening that out. I would usually tell clients, think about running down the middle of a road. So where the yellow line is down the middle of the road, try to run with one foot on either side. Don't let those feet cross over each other. If you feel your knees rubbing when you run, think about pushing the walls apart with your knees, or pushing objects away from you with your knees to help keep them rotated out. Watch your arms. Your arms mimic your legs. So if your arms are coming across this way, chances are your legs are coming across this way too. If your arms are rotating, throw in elbows, chances are your legs are rotating too. So if you can keep your arms swinging mostly front and back without a lot of side to side or rotating motion, most likely you're going to be helping to keep your legs tracking more front and back and less in or rotating. So those are just some simple things, definitely not cure-alls. If you have issues or you think you might have issues, either with quad strength or running gait, highly recommend that you seek out a physical therapist to do some testing and give you some guidance on how to improve maybe where your deficits are. If you have other questions, comments, or want me to take a look at anything, head on over to the website, www.runhappierpt.com, and shoot me an email. I'll be happy to chat. And as usual, references for this video are posted in the notes section. So thank you for watching, and I hope you enjoyed.